Imagine going about your day, whether you're at work, out with friends, or just relaxing at home, when suddenly, without warning, you're transported back to a moment of trauma. It feels like the event is happening all over again, as if no time has passed. Your heart races, your body reacts as if it's in danger, and it's hard to separate the past from the present. This is the reality for many people who experience flashbacks and intrusive memories as a result of trauma. For survivors of traumatic events, particularly childhood abuse, sexual violence, or severe accidents, flashbacks and intrusive memories can be one of the most distressing symptoms of post-traumatic stress disorder, PTSD, or complex PTSD. These memories are often triggered by sensory experiences, like certain smells, sounds, or sights that are tied to the traumatic event. They can leave you feeling like you're reliving the trauma, even though the danger is no longer present. In this article, we'll dive into what flashbacks and intrusive memories are, how they affect daily life, and practical ways to manage and cope with these overwhelming experiences. We'll also include real-life scenarios to illustrate how these symptoms can manifest. What are flashbacks and intrusive memories? Flashbacks and intrusive memories are hallmarks of trauma, especially for those living with PTSD. Flashbacks involve reliving a traumatic event as though it is happening in the present. Intrusive memories, on the other hand, are unwanted and distressing thoughts or images from the past that suddenly pop into your mind, often triggered by something in your environment. Both can cause intense emotional and physical reactions as your brain and body believe they are back in the traumatic moment. While everyone may occasionally recall a stressful memory, flashbacks and intrusive memories are more than just thoughts. They bring with them the intense feelings, fears, and physical sensations of the trauma. Common signs of flashbacks and intrusive memories. To better understand how flashbacks and intrusive memories show up in everyday life, let's break down the common signs and provide real-life scenarios to illustrate them. One of the most distressing symptoms of PTSD is when a person suddenly remembers a traumatic event with such intensity that it feels as though it's happening in real time. In these moments, it's hard to distinguish between past and present. 1. Reliving the trauma in an instant. You're sitting at your desk, working on a project. Suddenly, a loud noise from outside, a car backfiring, startles you. Instantly, you're no longer in your office. You're back at the scene of your trauma. Your body reacts as if you're in immediate danger. Your heart races, your palms sweat, and it's hard to breathe. Even though you're physically safe, your mind is convinced that you're back in that moment, reliving the event all over again. This kind of flashback can be terrifying as it pulls you out of the present moment and forces you to confront the trauma in a way that feels incredibly real. 2. Certain sounds, smells, or places, triggering overwhelming memories of past trauma. Triggers are sensory reminders of a traumatic event, such as a sound, smell, or place. These triggers can bring memories flooding back, even if you're not consciously thinking about the trauma. 2. The trigger of a familiar smell. You're walking through a store, and suddenly, you catch a whiff of a cologne that smells just like the one worn by someone involved in your trauma. Immediately, your stomach drops, and you're overwhelmed with memories and emotions. It's not just a passing thought. The scent brings the trauma rushing back so vividly that it's hard to focus on anything else. The rest of the day is spent feeling unsettled, as the memories linger in your mind, triggered by something as simple as a smell. Triggers like these can come out of nowhere and can make it difficult to feel safe, even in everyday environments. 3. Visual images or sensations from a traumatic event, repeatedly popping into your mind. Intrusive memories are distressing thoughts, images, or sensations from the trauma that pop into your mind uninvited. They can happen at any time, interrupting your day and leaving you feeling shaken. 3. Intrusive memories at work. You're in the middle of a meeting when suddenly an image from your past trauma flashes in your mind. It's a vivid, disturbing picture that you didn't expect or want to think about, but now it's all you can focus on. You try to push the image away, but it keeps resurfacing throughout the day. The more you try to distract yourself, the more persistent the memory becomes, making it difficult to stay present and engaged. Intrusive memories often feel uncontrollable, and their unpredictable nature makes it hard to know when they'll strike, which adds to the anxiety and stress they cause. 4. Experiencing nightmares that replay the trauma or are related to the traumatic event. For many trauma survivors, the memories of the event don't just appear during the day. They also invade their sleep in the form of nightmares. These nightmares often replay the traumatic event or involve themes related to the trauma, leaving the person feeling exhausted and emotionally drained. 4. Waking up in panic. You've had another nightmare. This time, you're back in the place where the trauma happened. Even though it's just a dream, it feels so real. You wake up in a panic, heart pounding, covered in sweat, struggling to catch your breath. It takes several minutes to remind yourself that you're safe, but the emotional and physical toll of the nightmare lingers long after you've woken up. For some, nightmares can become a frequent occurrence, disrupting sleep and making it difficult to rest or feel secure even at night. 5. Feeling. As though you are reliving the trauma when something reminds you of it. Flashbacks often make you feel as though you're reliving the traumatic event, not just remembering it. This can happen when something in your environment reminds you of the trauma, even in subtle ways. Reliving the moment. You're out with friends, having dinner, when one of them mentions a topic related to your trauma. It's a casual comment, but suddenly you feel as though you've been transported back in time. You're no longer in the restaurant. You're back in the traumatic event. Your heart races, your hands tremble, and your mind struggles to process where you are. Even though you're physically in the present, emotionally and mentally, you're reliving the trauma. These flashbacks are disorienting and can make it difficult to stay grounded in the present moment. They often leave people feeling emotionally drained and disconnected. Coping with flashbacks and intrusive memories. Flashbacks and intrusive memories can feel overwhelming, but there are ways to manage and reduce their impact over time. Here are some practical strategies to help cope with these symptoms. 1. Grounding. Techniques. Grounding exercises can help bring you back to the present moment when you're experiencing a flashback or intrusive memory. Techniques like focusing on your breath, touching a textured object, or using the 5-4-3-2-1 method, identifying things you can see, hear, touch, smell, and taste, can help remind your brain that you are safe in the present. 2. Therapy. Trauma-focused therapies such as eye movement desensitization and reprocessing, EMDR, or cognitive behavioral therapy, CBT, can be highly effective in processing traumatic memories and reducing the frequency and intensity of flashbacks and intrusive thoughts. 3. Mindfulness practices. Mindfulness meditation can help you stay grounded and develop a stronger sense of awareness around your thoughts and feelings. Over time, mindfulness can make it easier to recognize when a flashback or intrusive memory is coming and take steps to manage it. 4th, support networks. Talking to a trusted friend, therapist, or support group can help reduce the isolation and fear that often come with flashbacks and intrusive memories. Sharing your experiences with others can help you feel validated and less alone in your struggles. You can find peace. Flashbacks and intrusive memories are incredibly challenging, but it's important to remember that healing is possible. With the right tools, support, and strategies, you can begin to reduce the hold that these memories have over your life. Whether through grounding exercises, therapy, or mindfulness, there are ways to manage the symptoms and reclaim your sense of safety and control. You've already survived the trauma. Now it's time to take steps toward healing. You're stronger than you think, and you don't have to face this journey alone.